NYU is a great place to study public health. When you come to NYU's College of Global Public Health, you really come to the center of the world, where you will be surrounded by students from 40 different countries speaking 30 different languages. The NYU College of Global Public Health is striving to be in the top 10 schools of public health within the decade. It's been said that New York is where the future comes to audition, and we're not really auditioning anymore. Just recently, NYU ranked as the third dream college, behind only Stanford and Harvard. We are on the cutting edge. We are doing things in new and different ways. You have the opportunity to impact health worldwide, to work with world-class researchers. It's an exciting place. It's the place to be whether you're coming as a master's student or a doctoral student. We've created a cross-continental MPH program where you begin your studies here in the United States, move on to another country within the global networked university, of which there are 14 sites worldwide, and then move on to yet a third location and finish your degree in a one-year period. This exciting new degree allows you to graduate having lived and worked on 3 different continents within a 12-month period. When I was very young, I had an opportunity to see a lot of very sick people on the streets, sick people in the healthcare facilities that I would visit because my parent was working in the healthcare system. I saw a lot in my family in terms of death due to tobacco-related illness. For a long time, I was aware that something was wrong with the system. My journey to the field of public health is a very circuitous one. My first job was working in a psychiatric facility, administering a program for people who were suffering with alcoholism. I then moved from there to working for a very traditional academic medical center at an Ivy League university. And I found myself frustrated by constantly dealing with the curative end of health-related issues and having little opportunity to work on the end of the spectrum that prevents illnesses from ever happening. So I switched. To being an administrator in a school of public health and committed to a career in public health. What's wonderful about public health is if you're doing it right, something doesn't happen to someone that otherwise would have. They don't show up with 5 bullet holes in their belly in the emergency room because you worked effectively in state X to change the gun control laws in that state. They don't end up dying of tobacco-related causes at age 42 due to lung cancer, leaving 5 children motherless because you managed to change tobacco policy in their state that upped the price of tobacco and led them to quit before they really got started. It's sort of like if your water is clean and it's not killing the people who are drinking it or giving them lead poisoning, you don't hear a lot about it. NYU's College of Global Public Health is the ideal place for a lot of people. It's an exciting place. It's a place for bold thinkers. It's a place for people who want to change the world. It's creating whole new ways of approaching public health problems that are entirely outside of the box, whether it's through the application of using social media, of massaging big data to get answers to questions that previously couldn't be answered, if it's using the arts to impact the health of people, to find ways to break through to populations, to reinvent the way they view their own health and the way they participate in improving it. What really matters is that first, you are motivated to improve the world. You're interested in the health of people worldwide, and you want to contribute in some fundamental way to improving it. There are thousands of roles people can play worldwide that fit into being a public health student who's graduated and now is making an impact. Whether it's working in refugee camps, whether it's working in the United States healthcare system to improve the extent to which disease is prevented as opposed to always addressing it at a later stage. There's a place for people in public health who care. And to me, that's the fundamental requirement, that you care enough that you want to improve the world.